All right, returning to the other big story we've been tracking, India's first case of monkeypox has been reported in Kerala. A traveller who arrived in Kerala 3 days ago from the UAE was hospitalized after he showed symptoms of monkeypox. The condition of the patient is stable. Meanwhile, centre has rushed a high-level multidisciplinary team to Kerala. The team will be working closely with the State Health Department and recommend necessary public health interventions. Let's go to our doctor who's joining us this afternoon, Doctor Ishwar Gilada, Secretary General of Organized Medicine Academic Guild, also an infectious diseases expert, joining us this afternoon. Thank you, Dr. Gilada, for speaking to us. Monkeypox case now finally in India. Should we be worried?
I've been already worried because a country of 1.4 billion people, and when any new disease strikes to 63 countries with more than 9,000 cases recorded, it is just a matter of time. It could have come already in India. No doubt the first registered case is now. We should be worried because of two things. One is that we are still grappling with the COVID pandemic, and we are equating any new problem with COVID. So we only talk about surface transmission, aerosol transmission, droplet transmission. We don't talk about real transmission. Now, this is one of the sexually transmitted infection, STI, and I call it 21st STI in 21st century. So if you look at the current trajectory of cases and the current history of cases, almost 99% of the cases are sexually transmitted. And currently it is in the MSM, that is male sex with male. And 80% of the cases are in Europe. And then America, Canada, Australia, New Zealand, Singapore, and also India. So it's a matter of time. Unless until we decide and we declare what is it, our response will depend on that. Suppose we say it's like aerosol transmission, then our response is only public health. When you talk STD, then our response will go to National AIDS Control Organization, which is managing HIV, and it will be properly handled from that angle. That because they have a target population, which are a high-risk population, the population which having multiple sexual partners, MSM community, Hijra community, sex workers, or those male or female having multiple sexual partners. So currently, look at this as a STI.
Yes. Doctor, I want to ask you, what are the signs to watch out for in monkeypox and how do we guard against it?
You see, the signs currently are a little bit atypical monkeypox. We have had monkeypox in endemic areas in Africa where the signals and signs were different. But now what we see, they are perianal lesion, genital lesion more than on hands and palms and soles. But they can be also a singular lesion. Sometimes the lesions are up to 250 or 300 lesions also. But currently what we see, this hands and soles and palms and soles and feet, 1 or 2 lesion, 4 lesion, a couple of the lesions on the face. Second symptom is basically lymph node enlargement, which is either in the neck or also in the regional area where there are pox marks are coming. Pox mark can be water filled or pus filled. And this is a odinophagia or difficulty in swallowing. And then there are constitutional symptoms like fever, cough, malaise, a little bit loose motion. Those things are also there. Body ache, bone pain, muscle ache. So those things are also there. And what we need to guard is basically close, and not only close, very close human-to-human contact. Though it is called monkeypox, it is not no more transmitted from monkey to human. It is human-to-human transmission. So we have been requesting WHO that they should change the nomenclature because it attaches stigma and discrimination to the person who is affected, and people don't want to come forward.
Yes, interesting, Doctor. Doctor, and what is the protocol for this case, for the cases of monkeypox here? Is contact tracing done like we were doing for COVID?
There's a lot of difference between COVID and monkeypox because currently what they are looking at is he traveled in auto rickshaw, so they're trying to check auto rickshaw. They're trying to check the co-passengers. But till today, there is not a single case in such kind of contact. The cases are only very, very close contact, and very, very close means a sexual contacts. So let us focus on those contacts. Talk to him properly, take him in confidence. He would give probably the history. Keep everything confidential. Don't let it public. Because in India or in most countries, whenever such first, second, third cases are there, people go hounding. Like a huge team has gone from government of India to that place. So every minor detail of that person could be revealed. So I think we should take precautionary measures right now. We often talk about preventing discrimination, preventing human right violation, but we first violate. So stop those things and take preventive steps right now. And then only the people will have confidence and they will come out. Otherwise, people will not come out.